positive changes, and we appreciate that. Mr. Bartrum, I want to come to you. I'm a little confused over your statement regarding community care and want to get you to clarify your comments on that. Now, the chairman and I are both working on the community care issue. And when I talked to yesterday afternoon with the secretary, I know he is trying to simplify community care. But you made a comment that you need to balance direct care and community care. And I want you to drill down. What would that balance be, and why would you not say, let's prioritize what the vet wants, and if they want community care, let's make that more simple, a more simple process for them to access that care?
So, ma'am, I am saying that. If veterans want community care, we need to allow them to have community care. And when I say balance it, right now the bureaucracy is stacked against them.
Totally.
The bureaucracy is stacked against it. If I get confirmed, then I can work to help take out some of the bureaucracy. As a senior advisor, I'm very limited in what I can do. As the undersecretary, if I'm confirmed, then I can work to take out the bureaucracy that's there. But the best medical interest allows us to take out part of the bureaucracy. Changing what the contracts are as we do the next generation of contracts allows us to take out part of the bureaucracy. Building in the infrastructure, we also need to allow that if a veteran chooses that they want to use the VA healthcare system, the direct care system, that they have that choice to use that direct healthcare system. So it's working with them on where do they want to get their care and making sure that it's not bureaucracy that's getting in the way. It's where they want to get their care that's
and that
best for them.
they can access it in the most efficient
Yes.
and effective way. Okay, I appreciate that because talking about balancing, I think made it sound like you were going to do a little bit over here and a little bit over there, but not prioritize the vet in making those decisions. And talking to most veterans in Tennessee, they much prefer having community care because we've got 63 rural hospitals in our state. We've got 260 rural clinics, and they would much prefer going to something in their community because it enables them to get a neighbor or a friend to drive them and drop them off, and somebody doesn't have to take off work for the day and get them to Nashville or Memphis. So this is an issue. We've got a lot of veterans in Tennessee, and this is an issue that comes up regularly as we meet with the VSOs and as we meet with veterans groups. And what they want is community care. They appreciate what the chairman has done. They are crazy about my bill, which would get rid of that bureaucracy and give them the choice, put them in the driver's seat. And when you meet with these veterans groups and you hear what they go through and how long they have to wait, it is embarrassing. And I know you all inherited a problem at a very broken VA. And the fact that you had people that were working in VA healthcare that worked 5 days out of a 10-day work period in person, and VA benefits where they worked 2 days out of 10 in person. You can't get your job done if you are not showing up to work. So we appreciate that, but I think it is important that you speak with clarity on these issues and that we know you're not going to go soft on community care because that is what the veterans are wanting to see expanded. So,
Thank you, ma'am. And just to be clear, we're working to put veterans first and veterans' choice first. And so community care is a primary focus, and we've got to get all of the bureaucracy out of the way so that the veteran has the choice. And as a veteran of 40 years myself and the son of a veteran, I can tell you that I will continue to work for veterans and listen to veterans because the why that I chose to take this nomination was those are my brothers and sisters. Those are the people that I've gone to battle with They're my battle buddies, and those are the people that I'm here to serve. And so
Okay.
serve them I will.
Great. And Mr. Workman, I'll send something to you for a QFR. The electronic health records in that transition that is there from active duty to veterans, I'll send it. I'm out of time, so I'll send that to you for written.
Thank you, Senator.
Thank you.
Senator Blackburn, thank you. Committee, we have two senators that are present. At the end of those questioning, we're going to try to bring this hearing to a conclusion and make the vote at the very end. We have two votes, one of which has already started, so now it's Senator Hirono's time, and you may ask your questions.
Senator Marsha Blackburn expressed her appreciation for the nominees and acknowledged the ongoing efforts of the Secretary to improve the Department of Veterans Affairs. She raised questions about balancing community care with direct care for veterans and sought clarification from John Bartrum, nominee for Undersecretary for Health. Bartrum emphasized that veterans' preferences should be the guiding factor in their care. He explained that bureaucracy currently hampers access to community care, but if confirmed, he plans to work on reducing administrative obstacles and simplifying the process. He also noted that updating contracts and infrastructure would help streamline community care services. He stressed that veterans should retain the choice to use either the VA's direct care system or community care, depending on what best meets their needs. Blackburn highlighted that many veterans, particularly in rural Tennessee, prefer community care due to its convenience and accessibility, allowing family or friends to assist with transportation without major disruptions to daily life. Long wait times and administrative inefficiencies were discussed as significant challenges inherited by the current VA leadership. Bartrum reaffirmed his commitment to putting veterans first, removing bureaucratic barriers, and ensuring that veterans' choices guide the care they receive. Drawing on his 40 years of military experience and family ties to veterans, he underscored his dedication to serving those who have served the nation. The discussion concluded with Blackburn noting that she would follow up with questions regarding the transition of electronic health records from active duty to veteran status, while the hearing moved on to the next senator's questions.